patients affected are among the most vulnerable new mothers. Many of them say they'll either have to find a new doctor or go someplace else for care.
And doctors are outside!
Something's wrong inside!
Protesters gathered across from the UC San Diego campus today, speaking out against a new policy requiring contracted psychiatrists spend at least 60% of their work hours, the equivalent of 3 days per week, seeing UCSD patients. For new hires, that number jumps to 80%. The policy limits the time UCSD employed psychiatrists can spend in private practice or other work activities.
The majority of them are having to either increase time reluctantly or having to resign and leave their posts.
Dr. Simranjeet Brar is part of UCSD Health's Women's Reproductive Mental Health Program, which treats women who are pregnant, postpartum, or coping with pregnancy loss. A mother of 3, she can only commit about 40% of her time, meaning she now has to leave her job and her patients.
People that are pregnant, that are suicidal, that are depressed, that want to kill themselves. It affects the continuity they expect with their providers now.
One of those patients is Amber Maravich.
I was very surprised because I switched from another health system to UCSD thinking I was getting the best care. And to hear that my doctor is basically being forced out abruptly, it's very upsetting.
Amber, who has 2 children, including 6-month-old Brody, says her relationship with Dr. Brar is built on trust. Without her, she's unsure if she'll stay with UCSD.
I might leave the health system altogether because I don't like how they're treating their patients and their working mother physicians.
Another patient, Ashley Martinez, is facing the same situation.
They're basically filling her spot with residents, and I already had an appointment with one, had to re-explain my story, and then at the end of it was told by the resident, "You'll have a new one next time." So it's like constantly having to restart over.
UCSD Health says it employs 144 psychiatrists and that only 2 are out of compliance. Dr. Brar disputes that, saying she's identified closer to a dozen. She argues the policy disproportionately impacts working mothers. In a statement to News 8, a UCSD spokesperson said the policy is designed to increase physician availability and that the health system is hiring more staff and expanding the women's mental health program. Dr. Brar says that misses the point.
The argument that you're going to replace us and you have more does not answer the issue of harm that comes when you remove us from these coveted, very tender, vulnerable relationships.
Jenna Handy, News 8.